بسم الله الرحمن الرحيم والصلاة والسلام على أشرف الأنبياء والمرسلين سيدنا محمد وعلى آله وصحبه أجمعين. جزاكم الله خيرا for attending the Medicare and Social Security seminar. We are very excited to be here. We have a lot of very useful information, inshallah ta'ala, for the community. My name is Abdurrahman Al-Ulabi, and I come to you from Northern Virginia, near Washington, D.C. And this is my friend and brother, Usama Ustwani. We've been in the Medicare and Social Security field for a long time, alhamdulillah. And we are excited to share our knowledge, knowledge that is very important for the community. Not only for the seniors, but also for our younger brothers, because they as well have parents and elders that need to be educated in these matters. So inshallah, I'm not going to take a long time on the introduction because we only have 1 hour, and there's a lot of information to digest. So I'm going to jump right in, inshallah ta'ala, and start with the seminar.
Assalamu alaikum wa rahmatullahi wa barakatuh. The subject of Social Security and Medicare, inshallah, we ask you all to be patient with us. We will try to make it as exciting as possible. But this subject is a very difficult one to swallow sometimes. It can be very boring, but inshallah, with our presentation, and we'll try to make it as quick and as informative as possible. Alhamdulillah, we travel the nation and visit different masajid to help seniors age 65 and older, and anyone who's even on Medicare disability who's younger than the age of 65. We also do a bunch of other services as well to inshallah help inform our seniors about Social Security and Medicare. So to begin with, inshallah, we begin with Social Security. And I know, subhanAllah, mashallah, we've already had a few questions from before we even entered the masjid, and even while we were in the masjid, about Social Security and benefits and Medicare and how this works. So inshallah, we're going to give you the background of all of this so that you can be informed. And then if you have any private questions, you can find our information in the book. All our services, anything that we do for our Muslim brothers and sisters is always, there's never any fees for anything that we do. So you can feel free to call our team, and inshallah we'll always be able to help you out in the best way we possibly can. So first and foremost, we're going to begin with Social Security. So for those of you who have lived in the United States and worked here in the United States, you notice that when you get your pay stub, a significant amount, your primary insurance amount, goes towards your Social Security service. So that when you age and you want to collect your benefits for Social Security, that accumulates the amount of benefits that you're going to receive on a monthly basis from the government, inshallah. So how you qualify for the Social Security benefits is you're required to have 40 credits total in order to qualify for Social Security benefits. 40 credits, you're able to get about 4 credits every year. So it's 1 credit per quarter. And for 2022, the full credits amount is going to go up to 1,510. For those of you who are retired, even this year in 2021, it was around $1,400. It increases to get a full credit, increases every single year. So basically you have to make a minimum right now for the coming year of about $1,500, $1,500 every 3 months in order to be eligible for the full credit, which is not that much. So if you do have the full 40 credits, then we can begin the conversation of your eligibility for Social Security and later Medicare when we discuss that, inshallah. Very important tool that you should all have access to, that you should all go online and have access to and create an account. I highly recommend for everyone, even younger age, even if you're in your 50s, to open an account on Social Security Administration's website, ssa.gov. And on their website, when you make an account, they have all of your records of all of the income and everything that you made. And they even have an online benefits calculator. So what this does for you is it gives you an idea of how much your Social Security benefits are. And we're going to go into what age you can collect and when you should collect and how much your benefits will be if you wait. So this can also give you an idea to prepare for retirement, to figure out how much you'll get if you collect when you're first eligible to collect, and how much you'll get in Social Security benefits if you wait. So if you look in your folder that you have, on the left side inside the folder, there's some basic information about Social Security, some important information, and the estimator information is already there for you on the left side. On the right side, you're going to see information that goes in accordance with Medicare, which we will go over in a little bit, inshallah. So one of the most important questions is, you've been paying Social Security for all of these years. The government, Uncle Sam, has been taking a lot of money out of your paycheck every single month or every 2 weeks, depending on how much you get, how often you get paid. So you want to know how much this Social Security is, when you're going to be able to be first eligible to collect the Social Security. The first time you're eligible to collect Social Security, if you have the full 40 credits, which would be a minimum of 10 years of working in the United States, then you would have to be a minimum of the age at 62. At 62 is when you're first eligible to collect your Social Security benefits. However, if you collect your Social Security benefits at the age of 62, you will not get your full benefit amount. You will get your full benefit amounts when you get to your full retirement age. So if you wait until your full retirement age, you will get to your full benefit amounts. And if you see in your folder, there should be a little chart that shows you what your full retirement age is, and that will be on the next slide. How much can your Social Security go up? How can you maximize your Social Security benefits? The maximum amount that you can receive in your Social Security benefits is if you wait to receive your Social Security benefits at age 70. So some of you might wonder and ask yourself the question, why would I wait until age 70 to collect my Social Security if I can begin to collect my Social Security benefits at age 62? So inshallah, we're going to go over all the different options and collection strategies in a few. But basically, the most important thing that we need to know is three things. Number one, you are first eligible to collect your Social Security benefits at the age of 62. Number two, if you wait for your full retirement age, then you will get your full Social Security benefit. Number three, if you wait until the age of 70, then you get the maximum amount of Social Security benefit that you are eligible for. This right here shows you what your full retirement age is. Your full retirement age is based off of the year that you were born in. Okay, so if you were born between 1943 and 1954, your full retirement age is at 66. So if you collect your Social Security benefits before the age of 66, you will not receive your full benefit. So say, for example, say you want to collect at age 66 when you're first eligible. You will get a reduced amount. If you wait until 63, you will get a little bit more. If you wait until 64, you get a little bit more until you reach your full retirement age is when you get your most. Now, what happens between your full retirement age and the maximum of the age of 70? What happens is your Social Security will increase between 7 to 8% every year you wait from your full retirement age. So we'll talk about why that could be important and when you decide to collect your Social Security. So as you see here, 1955, it becomes 66 in 2 months, and then we add 2 months until we get to people who were born in 1960 or later. So anybody who was born in 1960 or later, the full retirement age is being pushed back to age 67. So what's also not shown up here is that if you were born before 1943, if you were born from 1942 and earlier, the full retirement age was 65. So for a very, very, very long time, the full retirement age was 65. So there's a reason why it keeps on getting delayed. And there's a reason why it went from 65 to now to 67 for people who were born in 1960. The reason is because the Social Security benefit was created by the government during the Great Depression. And during the Great Depression, many seniors were living in poverty, and it was a very, very difficult situation. So the government wanted to get involved so that no seniors will ever live in poverty anymore. And Social Security was never meant to be the end-all be-all for us, our full income. It was meant to supplement our income to help us, to help seniors to at least not live in poverty levels. So what you have to think about is when the Social Security first started, the life expectancy was much less than it is now. MashaAllah, we're all living for much longer than people lived when they first started Social Security. When they first started Social Security, the life expectancy for a female was almost around in the high 60 range, 65 to 72. And the life expectancy for the male was in the early 60s. Now, mashallah, the life expectancy for females is up to the 80s and for males is in their 70s. So what that means is people are living longer. That means they're collecting Social Security benefits for longer. That's why it's taking from the Social Security reserve and the government is running out of Social Security income. So that's why they're trying to delay it as much as possible by age. Now, some good news. Every single year we've done our presentation, the cost of living increase for the Social Security benefits, everybody at the masjid laughs. Because usually the cost of living increase, they raise your Social Security benefit, usually it's less than 1%. But actually, subhanAllah, this year, for the coming year in 2022, it's a whopping 5.9%, which on average it's being anywhere between $40 to $90 additional monthly for seniors. So for those of you who are not collecting Social Security benefits, you might think maybe that's not too much. Well, this past year and the years before, some people were getting sometimes 0.3% increase. They were not even getting a full dollar's worth of an increase to their Social Security. So this year, actually, this coming year, the Social Security benefits is jumping up by 5.9%. So this is how much on average you can collect in Social Security benefits. The average Social Security check for people that are on Social Security in 2022, it's going to be $1,657. This is the average from all the seniors, all the people who are eligible for Social Security benefits, even people on disability. The average around the whole nation is $1,657 a month, which again is increasing every year. And this coming year, it increased the most because the cost of living increased higher. The maximum amount people are collecting from their full retirement age is $3,345. So you're like, wow, mashallah, that's a big Social Security check to be able to collect $3,345 from the government every single month. How can I collect $3,345? Or why am I collecting so much less at my full retirement age? Keep in mind, the $3,345, this is the maximum what people are receiving at full retirement age. That means the people who are eligible to receive this amount that are waiting until they're 70, it's increasing even more. So it could possibly be even more than this. So how does Social Security, how does the government calculate how you qualify for, how much you qualify to receive in Social Security benefits monthly? So what they do is they take 35 years of working in the United States. So some of you might think, because a lot of the people that we work with, our clients, are people that came from overseas. I didn't work here for 35 years. Maybe I worked here for 20 years, maybe 25 years. I didn't work a full 35 years. So what they take is, say you worked for 15 years. They take your income for 15 years, and from 16 to 35 years, they put zeros for you. So this is why it's significantly less for you if you didn't work for 35 years in the US. So if you worked more than 35 years in the United States, say you worked 40 years or you worked 45 years, they use your 35 years of highest income that you used to average out how much you get in Social Security. So it's almost certain if you worked a full 35 years in the United States and you paid your taxes and you paid towards Social Security and you met your quarters, it's almost certain that you would be getting the range of $3,345 a month if you waited for your full retirement age. So if you're getting less, some people get 500, some people get 800, some people get 1,000. As you see here, the average is half of the amount. It's only 1,600. That's because most people haven't worked for the full 35 years. And when they put a zero instead of $40,000 salary or a $50,000 salary, it brings the average down a lot. So this is why your Social Security could be so much less. When are people in the United States collecting their Social Security benefits? Okay, so in comparison between men and women, usually women are collecting sooner than men, right? So at the age of 62, usually women, right when the Social Security benefit is eligible, more women are collecting at the age of 62. Not that many are waiting for their full retirement age or to the maximum of the age 70. When you look at the men's chart, you see it's an average between the age of 62 and between the ages of 63 and full retirement age. So this all depends on your situation, how much assets you own, whether you need the money. There's hundreds and hundreds of collecting Social Security strategies that if we sat down here and talked about them, we would need at least a whole week to discuss it, right? So this is something that if you had any questions for, you can contact us or ask us personally, because this is also a very personal question as well. So it really depends on what you have. For example, if you have investments, and you don't think that your investments will reach the maximum amount of the 7 or 8% that Social Security increases every year, and you have enough money that you can survive to keep on pushing back your Social Security, then of course, you're guaranteed that your amount will increase by 7, 8%, right? Sometimes the market can't, whatever investment you have, can't guarantee you 7 to 8%, whereas the government is guaranteeing you to have a 7 to 8% increase every year. However, we always recommend, if you don't have the assets, if you don't have investments, and you need the money now, always collect your Social Security as soon as you need the money. Do not delay it. Now, what happens if you decided to collect your Social Security and you're still working? This is very, very important to be aware of, because you will not realize what your penalty can be until you do your taxes at the end of the year, okay? So for example, if you decide to collect your Social Security benefits between the age of 62 and whatever your full retirement age is, again, your full retirement age should be in that chart in your folder. If you decide to collect between 62 and your full retirement age, if you make, for every $2 you make above $18,960, you will owe $1 back to the government. Again, every $2 you make above $18,960, you will owe $1 back to the government. So say, for example, if you make $40,000, $50,000 a year in income and you're also collecting Social Security benefits, you're going to get your Social Security benefits during the year. But when the government sees your taxes and they say that, oh, you're making much more than the threshold of $18,000, then you're going to have to owe all the money back to the government. So say, for example, your Social Security benefit was $1,300 a month, $1,500 a month, and the government's been paying this to you every single month. You need to be very careful. If you're making more than $18,000, you're definitely going to owe the government money back from your Social Security. So the question here is, if I'm paying the money back, do I ever get this money back, right? If I have to do my taxes and I owe all my Social Security benefits back, am I going to get this money back? So the way the government will look at it, they look at it as if you didn't collect Social Security benefits at all that year. So they actually will increase, when you do collect Social Security benefits, they will increase your amount by the 7 or 8%. So even though you're owing it back, but you will get it back later. Okay? This is why it actually doesn't make sense to collect your Social Security benefits if you are making more than $18,960 a year if you're still working, okay? In taxable income. Now, as you see here, these are earned income limits from 2021. Unfortunately, when we made this presentation, we were hoping that the IRS would update the 2022 amounts, but the IRS still has not updated the 2022 amounts. For 2022, I project it to be a little above $19,000 is the threshold. So if you make more than that, just be careful, because so that you're not surprised when you do your taxes for the upcoming year. If you wait to collect your Social Security at your full retirement age, then the income amount is raised to $50,000. $50,000. If you make $3, for every $3 you make beyond that, you will owe the government back $1 from your Social Security check that you're getting monthly. So if you're making a good amount of money, 60, 70, 80,000, $100,000, mashallah, every month, I highly recommend you to just delay your Social Security, because you're just going to have to pay all of that money back to the government at the end of the year. So it really doesn't make any sense. When can you make as much money as you want? If you wait until you're 70, there's no more income limits. Okay? So if you are going to work for that long, so usually people might retire. If you're retired and you're not earning any income, but you also need to realize there's other types of income. If you have a 401k, if you have certain types of investments, if you have a traditional IRA and you put aside and you have to pay taxes on these, this income that you receive or royalties from businesses, this will count towards your income. So you need to be very careful and discuss this with your accountant when you give you a certain time to help you figure out when a good time to collect your Social Security. And this is something that we can also help you out with, inshallah. Now, spousal benefits. What if your spouse did not work, right? What if your spouse didn't work? Your spouse has lived in America for over 35 years, right? You worked for 35 years, but your spouse never worked, right? Your spouse was just taking care of the home, right? So what happens to your spouse? Does your spouse not get any Social Security income? Actually, the spouse's Social Security income is based off of now the husband. Okay, so they go based off of the husband. The spouse, if they wait for their full retirement age, if they didn't qualify for Social Security income, they're eligible to get 50% of what you qualify for. So say, for example, you qualify for $3,000 a month in Social Security income, then your spouse will be eligible to get $1,500 a month when they decide to collect Social Security benefits. Okay, so your spouse will collect off of you. The benefits will reduce if it's collected before. So if your spouse wants to collect before the age of the full retirement age, just like collecting at 62, it is reduced. So this gives you a good idea of the spousal benefits. So if your spouse did not work at all and they don't qualify for benefits, or maybe they worked for 5 years or they worked for 10 years and they're getting 50% from you is more than their full benefit. Sometimes them getting 50% from your benefit is more than their full benefit. So they can choose their benefit or they can choose your benefit. Now, if your spouse decides to take it from your benefit, does it decrease your Social Security income? It does not. Okay? So it's your spouse's choice whether they want to collect their own or they collect off of yours. So obviously, whichever one is higher, they can collect. So the maximum a spouse can collect from their spouse that was working is 50% if they wait for full retirement age, if their spouse is still alive. However, there is a way your spouse can get more than 50%. This is called survivor benefits. Survivor benefits. So what happens here is if you pass away, your spouse could potentially be eligible to collect your full benefit amount. Your full benefit amount. Now, things change here. If you pass away, your spouse can collect their Social Security income even before the age of 62. They can collect at the age of 60. And actually, if you have children, mashallah, you're 65 or 66, 68, and you actually have children that are under the age of 18, which we've seen many situations like this, mashallah, your children actually qualify for Social Security benefits until they reach the age of 18. Okay, so here your spouse can increase the benefit. So your spouse can actually be eligible up to 71% of your benefit starting at age 60. If they wait until their full retirement age, then they can get the 100% benefit. Now, a question that we get often, what if I'm divorced? What if I was divorced from my spouse? Can I still collect from their benefits? The way you can collect from your benefits, a spouse can still collect from even their ex-spouse, is if they were married for a minimum of 10 years. They must be married for a minimum of 10 years. And even if an ex-spouse collects off of you, they will still not affect what you receive. Okay? So if a spouse was married to someone for a minimum of 10 years, they still are eligible to collect from their Social Security benefits. There's still a lot more about spousal benefits, about benefits for people who get divorced, about when to collect, when you can collect, what is the smartest thing to do to collect. Let's say, for example, the spouse has benefits that the spouse wants to wait for the husband. Maybe the husband wants to wait to collect his benefits because his amount is greater. So he might wait so his amount can get higher, so that if he passes away, then the spouse can collect a higher survivor benefit. Because if the spouse collects at a younger age, that is the maximum then that the survivor can collect from. The longer the living spouse, the greater spouse waits, also the higher amount increases as well. So there's a lot of collection strategies, and sometimes, unfortunately, especially in the Muslim community, what we've noticed is people just see, oh, I can just get my benefit right now, and they're not thinking about the future. They're not thinking about their spouse. They're not thinking, well, I already have money right now that I can live off of. They're not thinking about how can I increase my amount. Sometimes it is better to collect right at 62. Sometimes it is better to collect earlier. But sometimes you might have other opportunities that can help you wait a little bit longer, and it could be better for you and it could be better for your family. So there's so many collection strategies that we can go over, inshallah, but we cannot go over them tonight because it's way too many strategies. So right now we're going to take a short break for questions. Does anybody have any questions in regarding to Social Security? So what we went over some basic information in regards to Social Security. And right now we can take a few questions, inshallah, before we move on into Medicare. Yes, Brother Shifi. The maximum. I don't have that figure off the top of my head right now. But the maximum will be every year so if the maximum for the full retirement age average, a maximum is 3,300, you just add 8% every year. So you would just add 8% for age 67, 8% for age 68. So it's an increase of 8% for at least 3 years. So it would be a good amount. It would probably, if I were to guess, it would probably be around 3,800, closer to 4,000. That is the maximum for full retirement age. If you collect at full retirement age, that is the maximum. Yeah. Of course. So it's dependent on the 35 years that you worked, right? So again, yes, it depends on the amount that you make. So they take an average for 35 years of income. You're 65? Okay. And did you work here in the US? You've paid taxes. I see. I see. So we can talk about that. That's more of a personal question. There are situations we have helped clients that have never worked in the United States before receive Medicare Part A and Part B for free, and also receive $800 in Social Security every single month. US citizens that have worked overseas only, that have never worked in the United States. So there are many different things that you can do potentially to qualify for Social Security benefits. Mhm. That $2,000 is locked forever. The only way to increase it is if you wait. Yes, you're right. Thank you. So the only way for it to increase is the cost of living. Just like remember that 5.9%, that's the only way it would increase. Any more questions? Did you have a question? Okay, inshallah. We're going to continue. We have about 30 minutes left, inshallah.
Jazakumullah khair. So jumping into Medicare, we always hear about the A, B, C, Ds of Medicare. And what these are is Medicare is divided into four parts. Parts A and B are known as original Medicare. And then Part C is called Medicare Advantage plans. It's when a private insurance company buys the rights of Medicare from for an individual. So basically, instead of going with the original Medicare, you would go with a private insurance company along with all the benefits that they provide. And we'll be talking more about Medicare Advantage plans. And Part D is for drug plans. So Part A in the original Medicare is your coverage for hospital visits. So anytime you're an inpatient at a hospital or a skilled nursing facility, or you go to hospice care or home care, that is covered under Part A of Medicare. Part B covers all your outpatient services. So doctor visits, any outpatient surgeries, x-rays, labs, God forbid, chemotherapy sessions, all of those are covered under your Part B. And C and D, we already discussed. So let's talk more about Parts A and B, which are the hospital insurance and the medical insurance, so outpatient insurance. So first of all, what is the full cost of Medicare Part A? This is if someone hasn't worked in the United States and they're not eligible to receive any help for their Medicare benefits because they haven't paid for it through the years. That figure is around $259 to $471 for Medicare Part A. However, if you have worked through your career in the United States and you've paid to cover the Medicare Part A coverage, you actually do not pay at all for Part A. So this is if you've worked for 10 years, you've made the $1,500 every 3 months or so, you paid your taxes and your Medicare bills throughout basically your lifetime, then you don't have to pay for Medicare Part A. So what does Medicare Part A actually cover, and how much do you have to pay out of pocket? The worst thing about Part A is that the per admission deductible for any time you're admitted into the hospital. So, for example, say you go into the hospital and you're admitted as an inpatient in the hospital, you have an out-of-pocket deductible amount of $1,484. Keep in mind these numbers are the 2021 figures, and for 2022 they'll be a little bit above. We're projecting around the $1,500 range for the per visit deductible. Please highlight the word per visit. So this is per admission. So God forbid if someone is admitted to the hospital today and they leave the hospital after 3 days and then they get admitted again, then for both visits, they have to pay the per admission cost of around $1,500. Now, if you're admitted to the hospital and you end up staying there for an extended period of time, over 61 days to 90 days, there's a per day deductible that you're in the hospital, and that's going to be at $371, and it's going to be a little more in the year 2022. And for 91 to 150 days, that figure goes up to $742. And for the very rare case where you're there for an extended period of time, you actually get no coverage through Medicare Part A. Now, if you do end up staying in the hospital for a few nights, and then you need some extra care, there's also the option to go to a skilled nursing facility. And skilled nursing facilities are actually covered under Medicare Part A, but there's a very big caveat where it's only covered if you spend a minimum of 3 nights at the hospital first. So we've seen situations where someone gets admitted to the hospital and they don't end up spending the 3 nights at the hospital. Say after the second night, they get moved to a skilled nursing facility, then they're not covered at all for the skilled nursing facility care. And we've seen situations where that person, even though they're covered under Medicare Part A, would have to pay for the skilled nursing facility care from their own pocket. But after the 3 days or 3 nights at the hospital, then for the first 20 days at a skilled nursing facility, you're covered at 100%. Between days 21 and 100, there's a daily copayment of $185.50, and over 101 days, there is no coverage whatsoever. Moving on to Part B, we mentioned that we don't pay if you've reached the 40 credits for Medicare Part A. However, Part B actually has a deductible, a premium. So a monthly premium that you have to pay out of pocket to maintain your Part B coverage. For most individuals, that figure is around $148 per month. However, that is also dependent on your income level. So based on the amount that you make, there is an extra adjustment amount that you would have to pay. So as you can see here, if you're making over $750,000, the US government feels that you need to pay more for your Part B coverage. So they increase that amount by $356 for a total of $504 per month. Okay, so what does Medicare Part B coverage cover? We mentioned for Part A, the worst thing about Part A is the per hospital admission deductible of around $1,400. For Part B, you're covered at 80% of all outpatient services. So there is really no out-of-pocket maximum to that limit. So you have basically an unlimited amount of risk if you don't have anything supplementing your Medicare Part B coverage. For example, if you undergo an outpatient surgery and that outpatient surgery costs $100,000, then you are responsible for $20,000, which is 20% out of the total. There is no out-of-pocket maximum to that limit. So God forbid, if someone gets, for example, chemotherapy for every single visit, you have to pay the 20%. If you do lab work, MRIs, any other outpatient care, it's 20% of those charges. So this is one of the big caveats that we usually stress on because some people feel that Parts A and B alone are sufficient coverages when actually there can be a lot of out-of-pocket costs if that's the only coverage that you have.
So Abdurrahman went over with you guys what Medicare Part A and Part B cover. The Part A was the inpatient hospitalization, and Part B was the outpatient medical care. So there are 4 things that we get asked often, whether they're covered by Medicare or not, if you have nothing but Medicare coverage. Well, the 4th main things that most people have questions about is, number 1, is most dental care, your normal dental care like cleanings, dentures, bridges, root canals, etc. These things are not covered by Medicare. So if you want them to be covered, there's different options that you can find to resolve that issue, inshallah. Eye examinations. So sometimes people ask me if eyes are covered by Medicare. Yes and no. Whenever you visit an ophthalmologist, a medical eye doctor, yes, it is covered. If you're going to an ophthalmologist for macular degeneration, glaucoma, or retinopathy issues because of diabetes with your eyes, then this is covered by Medicare. Okay, however, routine eye exams for glasses, etc., this is not covered by Medicare. Hearing exams and hearing aids are not covered by Medicare, right? There are other solutions for that. Some cases of skilled nursing facility stays, like Brother Abdurrahman was talking about, how in Medicare Part A does cover skilled nursing facility stay if you get admitted, only if you're admitted in the hospital for a minimum of 3 nights. Sometimes you are not in the hospital inpatient for 3 nights. For those of you that are familiar with the medical field, sometimes they keep you in the hospital under observation. And the under observation is actually you are outpatient. You are still not admitted as an inpatient. So if you're under observation, they do not count that as 3 nights. So we've seen cases where people have been in the hospital for more than 3 nights. They get transferred to a skilled nursing facility and they still don't get the coverage. They think they're covered, but they're not. So the people that go to a skilled nursing facility that were not in the hospital for a minimum of 3 nights, what's happening is they're finding bills of north of $20,000 that they're getting to be responsible to pay for on their own. So you need to be very careful when you go to the hospital and they're keeping you, and it's time to, maybe they want to switch you to a skilled nursing facility. You have to ask them, was I inpatient for a minimum of 3 nights or not? You know, subhanAllah, last year we had, the whole world was going through the COVID-19 pandemic. So Medicare obviously had to figure out ways to cover our seniors that are impacted at high risk for the coronavirus. You know, alhamdulillah, last year we did this presentation for several masajid in the Southern California area. Unfortunately, we had to do it on Zoom. Now we're very excited to be here with you guys in person. So basically, Medicare will cover your vaccines, diagnostic testing. It'll cover pretty much all of the basic necessary things that you need for your, if you ever get infected with COVID-19 or think you are infected with COVID-19. If it's medically necessary, Medicare will cover you with or without any additional coverage. So when are you eligible for Medicare? We talked about when you would be eligible for Social Security. Now we need to know when you're eligible for Medicare. Social Security eligibility was age 62. Medicare eligibility begins at the age of 65 is when you can begin to have Medicare Part A and Part B coverage. Like Abdurrahman says, the majority of the people on Medicare pay nothing for Part A. If you have to pay something for Part A, that means you didn't work in the United States long enough. But everybody has to pay for Part B. Okay, everybody's paying $148 a month for Part B this year. It's probably going to be around $155, $156 next year in 2022. When can you begin to apply for Medicare Part B? It begins 3 months before your birth month and 3 months after your birth month. So for example, if you want to apply for Medicare Part B 4 months after your birth month, you are not eligible to do so anymore. You're going to have to wait until the enrollment period of the following year during July. July is the enrollment period if you've never had Part B, okay, of every year. And then you get penalized for not signing up for Part B when you needed to. So it's very important to know when you're eligible to sign up for Part B. If you work, you do not need Part B. Again, I already had a question before I walked into the masjid. Someone worked and they were paying for Part B. This is money wasted. You do not need to pay for your Part B. As long as you have credible coverage through your employer, then you do not need Part B. Once you retire, once you leave your employer coverage, then you go to Social Security and you sign up for your Medicare Part B. Okay, as we went over with Abdurrahman, you saw there's so many things that Medicare doesn't pay for Part A and Part B benefits. You have to pay $1,400 every time you get admitted into the hospital. Right? It's not that much, especially if they're paying, but if you have to pay it every single time, it becomes a lot. You have to pay 20% of every single outpatient service. So 20% of every doctor office fee, 20% of every outpatient surgery, 20% of anything that you do outpatient. This adds up and there's no maximum. Whatever insurance plan you've ever had, maybe there's a $3,000 maximum, $5,000 maximum, but here there's no maximum. You're paying 20% unlimited. Right? So what we always recommend, the safest option to cover what Medicare Part A and Part B does not cover is to take a Medicare Supplement plan. As you see here on the screen, these are Medicare Supplement plans. In 2012, Medicare made all the supplement plans standard. Therefore, if any insurance company wants to offer you any of these plans, the benefits must be the same. You are comparing apples to apples. No insurance company can give you better benefits or lesser benefits. The only difference between the companies is price. With us at Ikhlas, we're independently contracted with all of the insurance companies. So if you're ever curious how much one company costs, we give you a list of all the costs of every company, and you can choose whichever one that you wish for. Now, the most popular plans from the Medicare Supplement plans are Medicare Supplement Plan G and Plan N. You will find this in your folders as well. Okay? So Abdurrahman was showing you how Medicare Part A and Part B cover you, right? So here, this is Part A coverage. So if you have Medicare Part A, with the supplement plan, it will cover everything that he said Part A does not cover. So that $1,484 deductible that you have to pay every time you go to the hospital, you leave, you go back to the hospital, you leave, you don't have to pay it ever again with Plan G or Plan N. You would have to pay $371 daily if you were in the hospital if you did not have a supplement plan. But the supplement plans will pay that for you daily. Between 91 to 150 days, you have a $742 daily copayment. If you have Plan G or Plan N, they cover everything. Even if you were in the hospital for more than 150 days, Plan G and Plan N pay the bill at 100%. So if you have Medicare Supplement Plan G or Plan N, it doesn't matter what company it's with, you are guaranteed to have 100% coverage. You will never get a bill if you ever go to the hospital. You will never get a bill. No deductibles, nothing. How does the Medicare Supplement plans cover your outpatient care? If you go to the doctor, you have an annual deductible of $203, okay? You have to pay that deductible, okay? That's probably the smallest deductible you've ever seen, right? Once you pay $203 for any outpatient service, a doctor, office visit, whatever it is, blood work, then you have to pay the 20% and Medicare pays the 80%. But if you have Supplement G, as you see here, there's a check mark, it will always pay the 20% unlimited. So if you have an outpatient surgery that's $100,000, like Abdurrahman said, they'll pay that full $20,000. If you have, God forbid, cancer treatments, they're going to pay the full 20% of everything. Every doctor office visits, and doctor visits are expensive. Imagine paying 20% of every doctor bill, or blood work, or x-rays, CT scans, MRIs. All of these things are very expensive. So the plan will pay everything. So if you have Medicare Supplement Plan G, the only medical bill you will ever have is a deductible of $203. Nothing else. Everything is covered beyond that at 100%. So some of you might think, well, that's a great coverage. That's a lot of coverage. So what's going on here? How can they give you so much coverage? It must be expensive. Actually, the cost of Medicare Supplement Plan G is usually less than $120 a month. Less than $120 a month, you can get all of this coverage. And also, there's no network. You can go to any doctor, any hospital, anywhere in the whole US. Medicare is your network. So it doesn't matter what insurance company you have, the coverage is the same. So say you go to Texas, you go to Illinois, you go to Virginia, you go to New York, anything happens to you anywhere, you're on vacation, you're covered the same there as you would be here in California. So the coverage would be absolutely 100%. No medical bills with that option.
So going over to Part D now. So Part D is your Medicare prescription drug coverage. So how much do Part D plans cost? It's similar to Part B. It depends on the income level. However, it'll be around $30 to $35 a month in general. And there are certain features that a person has to compare when they're choosing a Medicare Part D plan. The first one is the monthly premium, so how much you have to pay every month for the plan. The deductible, if there is one, and the deductible is the amount that you have to pay out of pocket before any insurance kicks in. Your co-pays, so when you go to the pharmacy and you pick up your drug, usually there's a $5, $10, $20 co-pay depending on the medicine that you get. And very importantly, the formulary. The formulary is the specific medication for each individual person. That differs from person to person, and that will determine mostly the price of the plan that an individual ends up selecting from an insurance company. Drugs also have different tiers. This is very important to know. There is preferred generics, non-preferred generics, preferred brands, non-preferred brands, and specialty medication. And the summary of what these are is every insurance company has contracts with pharmaceutical companies. And they place those specific drugs in certain tiers with certain prices. So one insurance company can classify a certain drug as a preferred generic and have a very, very cheap price for it, while a different insurance company can call that a non-preferred generic with a higher price. But all in all, in the summary of the slide is all insurance company drug plans are different, and it's very important to know your specific medication in order to get the best plan for what you need. And this is something that Ikhlas Insurance can definitely help with, because it's very different between different individuals. So what are the stages of coverage for drug plans? You have the annual deductible of up to $445. So this is what you have to pay for medicine out of pocket before the plan kicks in. The initial coverage period, which there is a copay that you have to pay along with the co-insurance, and then the plan covers the rest. And stage 3 is the coverage gap, also known as the donut hole, which the patient is responsible for a quarter of the drug cost once $4,130 is reached. So once that amount is reached, and there's still more drugs for the year that the individual needs, then the individual is responsible for 25%. But once you reach the amount $6,550, then that goes down to 5%. So at that point, you have to only worry about 5% of the drug cost once you reach the catastrophic coverage. There is a late enrollment penalty when enrolling into Part D. So this is very, very important to note. Even though it might look like it's small, this late enrollment penalty is actually for life. I think going through an example is the easiest for this, but it's basically a 1% extra charge for the Part D plan for every month that you delay getting a Part D coverage when you're first actually eligible for a Part D coverage. So let's take an example here real quick. Let's say you wait 24 months, 10 minutes? Okay. Let's say you're eligible for Medicare Part D today, and you end up not signing up for a Medicare Part D plan. You wait 24 months or 2 years. For every month that you wait, you have to pay around 1% of the total premium, which is around 33 cents. However, that is cumulative, and that is for life. That penalty is for life. So you're 24 months late, and then you end up getting a Part D plan. You have a $7.92 every single month penalty for that plan. So you'll end up having to pay $8 more, or almost $8 more throughout your life for a Part D prescription plan.
So inshallah, actually, we're going to skip the break here with questions because we only have less than 10 minutes left. So I'm going to try to conclude the presentation real quick and go over these things. So when you go on Medicare, you have Medicare Part A and Part B. You have 3 options. Either you keep Medicare Part A and Part B only and take nothing else and pay all of the out-of-pocket expenses that come with it. Option 2 is to take a Medicare Supplement plan like we discussed. With the Medicare Supplement plan, you pay a monthly fee of around $100, $120 a month, and then you'll never get medical bills. You only have a $200 deductible, and everything is covered beyond that at 100%. Option number 3 is an all-in-one plan. This is what we said in the beginning, Medicare Part C, okay? Some people take the Medicare Part C option. Taking a Medicare Supplement plan is the safest option because you're covered everywhere, and you're never going to get a medical bill. Whereas with Medicare Part C, there's a lot more involved with the Medicare Part C. So because a Medicare Part C plan, it includes Medicare Part A, B, D, which is what makes the C. So everything that we discussed, Medicare Part C brings into one plan. Medicare Part C plans, you can get them for free. They can cost you nothing. So we said supplement plans are sometimes $100 a month, $120 a month. And on top of that, you also have to get an additional prescription plan, which is anywhere between $15 to $30 a month. So you might be paying close to $120, $130 a month for these plans. Whereas a Medicare Advantage plan, you might get it for free. And this is what you'll see more commercials on TV for, and even on your computer. Insurance companies try to advertise these plans a lot. Why? Because actually insurance companies make much more money off of this. Because the reason why they can offer it to you for free, you've never seen an insurance company give you free insurance, right? This is why, like with Obamacare, sometimes maybe you've heard your kids complain, Obamacare plans are so expensive, they're like so much a month, and they have like a $10,000 deductible, right? So how come for older people that will use the insurance more, they're giving it for free? The reason why is because the government pays the insurance company $15,000 to $20,000 a year to take your responsibility away from the government. So now the government's saying, okay, we're not responsible for this person anymore. The insurance company is going to do it. So the insurance company is getting $15,000 to $20,000 a year. So with that, this is why they can give it to you at no cost to you, right? You still have to pay for your Part B, okay? So what's happening here is it's not 100% coverage like the supplement plan. You're going to have co-pays. You're going to have maximum out of pockets. You can actually potentially pay between $5,000 to $10,000 a year in out-of-pocket medical expenses with a Medicare Advantage plan. But people who try to offer this plan, they don't tell this to you up front. They just tell you, oh, I can get you an insurance plan for free. But then you realize when you go to the doctor, you go to the hospital, you might start to get bills. So this is how it works. The federal government, it pays the private insurance company, which then the private insurance company gives you the benefits. There's a lot of pros and cons for Advantage plans. For anybody who comes to me and tells me, brother, I've been healthy my whole life, I don't believe in insurance, I don't want insurance, I don't think I'm ever going to use it, I give them a Medicare Advantage plan. It's free. There's no cost, right? But it's better to take an Advantage plan than not having anything. Because if you don't have anything, you just have Medicare Part A and Part B, you could potentially pay thousands of dollars if you get sick. Whereas with an Advantage plan, at least there's a maximum to what you can pay because they have a maximum out of pocket. The maximum could be $5,000, it could be $6,000. A maximum of $5,000 or $6,000 is better than no maximum, paying hundreds of thousands of dollars for outpatient surgeries, okay? Another benefit of Medicare Advantage plans is that they give you additional services such as dental. They'll give you free dental service. They'll give you free eye coverage. They'll give you sometimes gym membership. Sometimes they'll give you a credit card for you to go buy healthy groceries. Sometimes they'll give you an allowance for over-the-counter medication. Now, one of the bad things about Advantage plans is you have a network. So you cannot necessarily use it anywhere you want. Sometimes you have to go to their hospitals. You can either have an HMO or a PPO plan with an Advantage plan. If you decide that an Advantage plan is best for you, please do not touch HMO plans because HMO does not cover out-of-network. If an ambulance takes you to an out-of-network hospital, you're paying the whole bill, okay? Get a PPO plan. There's a lot of free $0 PPO plans that we can help you find. Okay, so PPO plans are going to be the best. They're still going to be expensive out-of-pocket costs, but it's going to be a much better option. So there's a high hospital copay. If you have a Medicare Advantage plan, you're probably going to pay between $300 to $500 a day for the first 5 or 6 days if you go to the hospital. There's a lot that goes into this. Unfortunately, I don't have the time to go over this. Inshallah, after Salah, we're going to have a table outside. If anybody has any private questions they want to come ask us, you can feel free to do so. Or you have our numbers. Again, all this, anything that we do, you call us. We never charge anything. You could just call us, get your advice, and then hang up. We can just be there to help you, inshallah. Right now, we're in the annual enrollment period. This is the time to make changes. This is time to ask to see if you have the best options. It's from October 15 to December 7. What do you do when you retire and you leave your employer plan? We have forms, or you can go to Medicare, but we can help you. There's forms that you need to sign up to change to sign up for Medicare Part B, and that's something that we can definitely assist you with. Now, Medi-Cali, let's go over this real quick so we can end the presentation so we can get for Isha prayer. Medi-Cali is the state Medicaid. How do you qualify for state Medicaid? Okay, for an individual who's single, the maximum monthly income must be $943. Again, these are 2021 numbers. 2022 numbers are going to be higher. The 2022 numbers are not there yet. Okay, if you make less than this a month, you qualify for Medicaid. Okay, that's amazing. That means you might not have to pay for your Medicare Part B, and you get a lot of additional benefits. You don't need to pay for anything. Okay, don't pay for something that you don't need to pay for. Okay, that's something that we want to make sure. We want to make sure that all of the Muslim seniors, if they don't have to pay for insurance and they can get free benefits from the government, we want to make sure to help you to do that. If you're married and you file joint, the maximum is $1,500. How do you apply for Medicaid? You go to Social Security website, or you go to coveredcacalifornia.com. If you are on Medicare and Medicaid, you become dual eligible, and you become eligible for much more benefits, inshallah, and that's something that we can also go over as well. Unfortunately, we don't have time for Q&A right now. We have to stop for Isha Adhan. But if you guys have any questions, again, after Salah, we're going to be at a table in the back. You can come to us with your private questions. You can also visit our website, ikhlasinsurance.com /book/online, where you can make an appointment with any of our Medicare professionals, and we can help you and assist you in any way that we possibly can, inshallah. And jazakumullahu khairan for having us. We're very grateful for this opportunity, and if there's anything that we can ever do to serve your community, we would love to do so, inshallah. Jazakumullahu khairan. Wassalamu alaikum wa rahmatullahi wa barakatuh.
الله أكبر الله أكبر الله أكبر الله أكبر أشهد أن لا إله إلا الله أشهد أن لا إله إلا الله أشهد أن محمدًا رسول الله أشهد أن محمدًا رسول الله حي على الصلاة حي على الصلاة حي على الفلاح حي على الفلاح الله أكبر الله أكبر